Hi, this is Dr. Kelly Harper, founder of Tuscan Ridge Animal Hospital, and today we're going to talk about lab work in cats. Lab work in cats, to me, would be what I would consider the minimum database would be a complete blood count, or what is commonly abbreviated as a CBC. This portion of the blood work lets me look at the cat's immune system. Red blood cells, white blood cells, helps me identify whether there's any infection or anemia or just general problems with the immune system. I would also pair that with what we call a comprehensive chemistry panel. This portion of the blood work allows me to look at organ function, pancreas, liver, some GI areas that might focus on the gastrointestinal tract, as well as the electrolytes. And then we also like to look at what's called a total T4. That would be a test that helps us to evaluate the cat's thyroid function. And then lastly, a urinalysis, a complete urinalysis, which allows us to make a complete picture of the cat's kidney function when paired with the other portions of the lab work, as well as rule out any signs of urinary tract infection or just problems in the urinary tract itself. There's also some lesser known blood work tests and or just laboratory tests that we use for cats for annual screening as well, or maybe just once in a lifetime screening. The one that comes to mind first would be the feline leukemia and FIV test, oftentimes referred to as the feline combo test or combination test. Feline leukemia and FIV are both viral infections that are specific to cats. This testing is run on just a couple of drops of blood, and we generally recommend this testing for kittens when we first start seeing them early on in life, and then certainly can be run at any other point in time in life if we think that the cat has either had a history of potential exposure to feline leukemia and or FIV, and or whether or not we maybe their medical history lacks information regarding this testing, and we're suspicious that those viruses may be a problem for that cat. And then lastly, I would say would be fecal screening for intestinal parasites. Sometimes we think about that more commonly in dogs because many cats stay indoors, but cats are prone to intestinal parasitism just as much as dogs are, even indoor-only cats. So that kind of testing, we ask that an owner would bring a stool sample with them when they come to their visit, and we like to test that once a year, just like we do the blood work. Lab work is important for all of my patients for the same reasons it's important for me when I go to my doctor, because performing annual blood work is a wonderful way to screen for early disease processes, and it allows us to have what we consider a historical database of information about that cat, so that as we continue to run blood work annually, we're able to see trends. You know, oftentimes we think, well, they're young animals, so it's a young cat, and they're not going to have any problems. Well, maybe they don't for the first couple of years, and we get that lab work back, and there's no visible problems with that lab work. However, what we can see is that for any given parameter that we're looking for in the blood work, there's a range that is considered normal for that animal, or for that species rather. And so if we start seeing on repeat lab work year over year that cat's, let's say their BUN or their creatinine is starting to trend up over time, we might start to think, maybe they're developing some early kidney dysfunction. Similarly, we may find on lab work that the value for any given parameter maybe just runs a little bit low. And because we're able to document that is a consistent finding over a number of years, we come to realize that may just be normal for that cat and is not necessarily indicative of a more serious problem. We recommend that lab work be done annually for all cats. certainly up until the age of maybe 8 years of age. And after 8, most of us in this profession start to look at both cats and dogs over the age of 8 as kind of falling into a senior pet category. And so I'm going to dial in a little tighter on my thoughts about that cat and the history that I get about that owner, and I'm going to be really focusing on seeing if we're seeing any trends that are moving up or down over the course of that cat's life. And so again, I think annual blood work is at a minimum is critically important for all of the cat patients that I see. After age 8, I might start recommending every 6 months or twice a year, because illness happens quickly in cats, and cats are notorious for hiding their illness. So oftentimes owners are not perceiving there's a problem until it's very late in the disease process, but lab work can show us those trends earlier than the cat will be displaying the problems outwardly to the owner. So there's 2 main ways that blood work is collected from cats. The most common and the most efficient way to be able to draw blood from a cat would be through a vein in the neck. And this is, by the way, the same way we draw blood work from our dog patients as well. It's a very good vein in most cats, and it allows us quick access and be able to collect the large volume of blood that we need in a very short period of time with minimal stress to the cat. Alternatively, depending upon the health state of the cat and or the cat's temperament, sometimes it is a little bit easier to be able to draw blood from the inside of the back leg. No, I would say painful. It is absolutely not painful. It is a single needle stick or poke through the skin to access the vein that we need to collect the blood from, and that's frankly no different than it would be if we were giving your cat a vaccination. And so most owners who are in my exam room when we're giving vaccinations will notice that their cat has a very minimal and or momentary reaction to getting a vaccination. So I would say it's on par with that. With regards to the anxiety or stress component of that question, I would say that really depends upon the disposition of the cat. There are many cats that I've seen over the course of my career that are very calm, very generally happy and easygoing when they're in my office just for a wellness exam and no vaccinations. Those cats tend to do very well for the 30 seconds or 1 minute that we need to carefully restrain them to collect a blood sample from them. I will say that there are certain percentage of the population of cats that I see and that most of us see in veterinary practice that do tend to be anxious. They're just anxious because they've been in the car and there's a barking dog in the lobby, and they just don't tend to travel as well, and so they tend to be more anxious. And so for those cats, we generally will recommend a pre-medication for those cats coming into the appointment, not just to allow us greater ease and efficiency in collecting blood samples from them at the end of the appointment, but also just to reduce stress for that patient coming into the hospital. So thanks for spending some time with us today. I hope you found this chat informative. If you have any questions, don't hesitate to reach out to us at Tuscan Ridge Animal Hospital.